Yes, the sad bit is that for women who have means or are able to pay for services will continue to receive and access safe services. So this policy, what we are seeing is that it's continuing to marginalize those who are on the fringe of health services. This includes also young women. A good example is one of the organizations that provided free services to women and girls under the age of 18 now can no longer provide free services. They have had to even shut down some of the facilities. So there is a lot of pressure on services that were either highly subsidized or even free, and these are being shut down. What this means is that women who have been marginalized continue to be further marginalized. So we see that this is also a reproductive justice issue.
Absolutely. Great. So I just want to give a little context about our project before diving into the findings.
Yes.
So IWHC's documentation project is not only in Kenya, but also in Nepal, Nigeria, and South Africa. So I started talking about those a little bit earlier. In the first year of the project, we did about almost 60 interviews, and in the second year we did 118. So the data I'm presenting is coming from more than 170 interviews that we did with civil society organizations, those working on comprehensive sexual and reproductive health, but also some that are doing HIV or other global health focused work with government agencies in these countries and multilateral organizations. We even did our best to reach out to some organizations that are kind of on the other side of things and are kind of anti-women's rights or against abortion to get a holistic perspective on what's going on. And then diving into our findings in the second year, it's exactly what you're saying. This policy is really harmful to girls, to women, and to marginalized populations. It's depriving them of essential health services and information, and it's not just about abortion. It's really affecting a whole array of services. So, for example, when you force a clinic to close, it is not just one type of service that's affected, especially in rural and remote areas. People might have to travel really far to access any kind of health service, and therefore, all services need to be integrated. There's really only one place that people can go, or one doctor in the region that can provide healthcare. And so it's the HIV services that go, it's the pregnancy services that go, antenatal care services that are no longer supported. And so that's why it creates a really difficult choice, because even if doctors or providers know that access to information and referrals about abortion services is life-saving and that women in their communities need access to that, the choice is between continuing to provide that So the choice is between continuing to provide that very needed service or continuing to have funding to provide all of the above services. And it's really heartbreaking to have to make that choice.